Afternoon, you over, and just another quick video clip. Just seen a comment from somebody in there saying we haven't done theme 3. I've done one before that's got 2, 3 and 4 all in together because they're quite similar, but hey ho, we'll do a theme 3 one just exclusively anyway, because it is one of the theme overviews that I've not asked about before. So we're saying that theme 1, 3 and 5 are ones that have never come up, so therefore could come up. Right, okay, so here we go. So theme 3 is treatment and cure, which you're going to find that you say fairly similar things for that theme to what you do for knowledge or prevention. Now, what should you include? Right, okay, so medieval. In terms of treatments and cures, they are all based around the 4 humours, which is the idea of Galen and Hippocrates. Galen, you might just chuck in there this idea that he used pulse as a diagnostic tool. But generally, the treatments and cures are about the idea of the 4 humours being out of balance. So any treatment is connected to those, like bleeding, leeches, sorts of things. Okay, so next one, we mentioned alchemy and superstition are used as treatments, which is the idea of the church, which is also general superstition, like soothsayers, etc., and their potions and remedies used. Alchemy is the discovery of chemical properties and things like that. First started to be used in the medieval period. We didn't really know what they were doing with these things. And then obviously bleeding, which is connected with the 4 humours. So, you mentioned those things. So generally we're talking about, in the medieval period, we are talking about fairly limited treatment and cure if you're talking about what change has taken place. Although Galen pushes medical ideas forward, we still are fairly limited. Now, if we go into the early modern, what is being used to treat and cure? Well, there's a more scientific approach. We know that the Royal Society has been set up. Ideas are being generated and used by the printing press, set up by Caxton. So we've got a few ideas that are moving forward in that respect. Okay, they've also still got barber surgeons. However, they do make a bit of a move forward with the likes of Pare, who discovers ligatures. He also discovers egg white rose oil and turpentine as a treat for gunshot wounds, as opposed to Bernacotte oil, which increases the success rate of being treated for an injury on the battlefield. So you do see some success in terms of treatment. I would also chuck in there another individual that used to treat is Alexander Gordon, who used chlorinated water as a treatment for child bed fever. Okay, you've also got the crazy ideas of use of treatments and cures like rhubarb, wonder drug. Tobacco is a wonder drug. It's not a wonder drug, is it? But that's what they thought, and that's what they used them for in the early modern period. So, again, we've seen some movement forward, but we also see continuity. Some of these ideas, like the 4 humours, are still in place in the early modern period, but we have got a few movements forward. And obviously, you could, I suppose, chuck in the ideas of Vesalius, because obviously he's going to improve treatments because he improves understanding of anatomy, but you've got to make that clear. Now, into the industrial and the modern era, and obviously treatments and cures improve. Now, I'll put these in the wrong order. We should talk about Simpson and Lister first of all. They're really important in terms of treatment and cure, because obviously one of the big treatments is surgery, which is the field that they exist in. Now, Simpson is a treatment for pain, because obviously pain is a massive barrier. If you don't deal with pain, you die of shock during surgery, and he uses chloroform. Lister uses antiseptic in the form of carbolic acid. Okay, and between the two of them, they managed to cut the death rate in surgery from 50 to 15%. Okay, so that's a massive move forward in terms of treatments and cures. Now, you've also got individuals as we step into the modern era, like Marie Curie, whose X-rays were used to more effectively treat injuries in World War I, and obviously later on X-rays are pretty important in terms of treating people. You've also got the likes of Christian Barnard, who did the world's first heart transplant. You've also got major ones like penicillin, which I've not listed there, discovered by Fleming, and then mass-produced by Florey and Chain and used in World War II. Got a £10,000 grant from Oxford University. Absolute peanuts in today's money, but huge in terms of developing and treating, because, I mean, let's be honest, penicillin and antibiotics are probably the biggest treatment in the modern era. Now, anything you can think of that is a treatment, so we talk about like Marie Curie is also developed in terms of radiology and in terms of cancer treatments that we've now got today. So there's absolutely loads of stuff you can mention, but those are the main ones.